Are you looking for peace of mind at your doorstep? Look no further. With the Blink Video Doorbell, your home's entrance is always within your control. Check out the link in the video description to learn more and get your Blink Video Doorbell on Amazon. Your home is in your hands.
A 7-year-old boy from Hampshire has become the first patient in the UK to undergo robotic surgery for a kidney condition. Rhys Wilton, from Gosport, underwent the pioneering operation involving the Vergis surgical robotic system at Southampton Children's Hospital, SCH. The youngster was diagnosed with pelviureteric junction obstruction, a condition in which there is a blockage or obstruction of urine flow from the kidney into the ureter. The condition affects between 1 in 1,001 in 1,500 children, and if left untreated can lead to loss of kidney function over time. Consultant pediatric urologist Ewan Brownlee performed the robotic-assisted laparoscopic pyeloplasty procedure, which involved repairing the narrowing at the junction of the kidney pelvis and ureter. Mr. Brownlee said, "This has been 3 years in the making, so it's really exciting for the whole pediatric urology team, and pediatric urology in the UK, that the first operation has finally taken place. The evidence for use of robotics in surgery shows clear benefits for patients, from quicker healing time and smaller scars to, in some cases, better overall outcomes. I'm hoping that this is the start of seeing an increase in minimally invasive surgery for children all around the UK when this becomes more widely available." Rhys's mother, Elizabeth Wilton, said, "Rhys was nervous about his operation before, but we showed him pictures and he was quite excited to know a robot was operating on him. We have complete faith in the team at Southampton Children's Hospital, and we are incredibly happy that Rhys is benefiting from this pioneering trial." The robotic surgery system has a 720-degree range of motion which allows the surgical instruments to be small enough to perform complex operations on pediatric patients and is being used as part of a study, which will involve 150 patients. The robot, created by UK company CMR Surgical, uses a unique wrist rotation for easy manipulation of the tip of the instrument, which allows for the instruments to be smaller than otherwise commercially available, minimizing the size of incision required. Microsoft hit by massive outage across Europe days after global IT meltdown. Archaeologists find 2,000-year-old preserved mummies in sealed tomb. Cutting out these breakfast foods could reduce dementia risk. Millions are at greater risk of dementia simply from breathing. Stephen Griffin, consultant pediatric urologist at UHS, who assisted during the operation, said, "Personally, I think this will be one of the most exciting developments within the field of pediatric urology over the next 10 years. UHS Chief Medical Officer Paul Grundy said, "We are proud to be at the heart of the research that will hopefully lay the foundations for others in the near future." Mark Slack, co-founder and Chief Medical Officer at CMR Surgical, said, "We are delighted to begin the world's first pediatric trial using Vergis in the UK. The small, modular design of Vergis, and small instrument diameter, provides an opportunity to be able to perform robotic-assisted surgery for the treatment of pediatric patients." Get in touch with our news team by emailing us at webnews@metro.co.uk. For more stories like this, check our news page. More bad news for fry-up fans as cutting these breakfast foods could lower dementia risk. More, a cancer drug could give me more time, but my life isn't worth the cost. More, wildfires are burning across Europe, but there's more than flames to worry about. Privacy policy.